chaotic time. Hey everyone, it's Bernice, and for those of you who don't know me, I am an emergency medicine resident physician. I treat both adults and children, and I'm here to talk about what is going on. What is this RSV virus that is taking emergency rooms by storm? Why are so many kids so sick, and why are hospitals so full right now?
RSV, or respiratory syncytial virus.
Data shows children are filling hospital beds more now than over the past 2 years of the pandemic.
Long wait times and packed emergency rooms full of kids. Doctors telling us they're seeing RSV cases on the rise.
How much of a strain is this putting on the medical center?
It is difficult. Obviously, we have some healthcare heroes, our nurses, our respiratory therapists, our pediatric residents, emergency medicine personnel, our doctors, and everyone is working overtime.
For those of you who may be familiar with how things normally go, every time we hit right around the fall season, just a little bit after kids start going back to school, we will see a big spike in the number of kids who come into the emergency department and have viruses, cough, congestion, that sort of thing. There's always a small subset of those kids who have something called bronchiolitis, which is a more severe reaction that the body has to a virus. Bronchiolitis is literally inflammation of the bronchioles, which are the distal tubes of our airways. In young kids, when they get this inflammation of their airways, they can be very, very prone to what we call respiratory distress, which means literally using muscles under their ribs, muscles above their clavicles, all these extra muscles to try to support their breathing as much as they can. So we literally, when we're examining them, can see the muscles flexing in their bellies, on their neck, etc., of them trying to breathe and support themselves through this illness. We see it every year. This year, something really, really different seems to be happening. Just bringing you back a couple years ago when the COVID pandemic really surged, everybody, and then including kids, were home from daycare, or even if they were going in person, masks were mandatory. People were super careful about being separated, etc. That was the lowest season for RSV and all of these other viruses that we normally see in recent history. Emergency rooms were empty, and it was pretty remarkable. It was pretty amazing to see that the kids were not getting sick the way that they normally get sick. Fast forward a couple of years though, the pendulum has completely swung in a way that is truly unprecedented. Now we're in a position where we are completely full in the hospital, and people are now doing something called boarding. And boarding means that you are literally sitting in the emergency room when you are supposed to be sitting in an ICU, when you are supposed to be sitting in the general pediatric floor to be managed by people who are trained to do long-term management. Somebody like me, I work in the emergency department. My training is very focused on how do I stabilize people in the acute setting, and then how do I make sure that they get into a safe long-term location until they're fully back to baseline. Now what's happening is that I have patients, and this has happened to me multiple times over the past couple of weeks, where I'll come in, I'll manage them for my shift, go home, come back the next day, and they are still sitting in that emergency room, which is horrifying. But there's nowhere else for them to go because the ICU upstairs completely and totally packed, and kids are just not getting better as fast as they used to. The pediatric floor the same. And then even worse, when I'm working in hospitals where there isn't an ICU in the house, where there's not enough beds in-house, you are calling hospitals that have ICUs left and right. I'm literally calling even sometimes the next state, trying to find somebody who has capacity to take a very sick kid who's sitting in the emergency room on extremely high levels of oxygen working to breathe. And it's actually really, really tough to watch this happen. I mean, like, literally, we have signs like their nose is flaring to try to get as much air as possible. Sometimes we have something called head bobbing, where like little kids are working so hard to breathe, their whole body is, every muscle is engaged, their nose is flared up, that their head literally starts to bob back and forth because they are trying so hard and so desperately to get air in. Like, imagine how scary that looks. And then for us in the ER, we're used to being able to stabilize them, at least give them the oxygen support that they need, understand that they're going to need that for, you know, perhaps the next several days while their body is fighting the illness, but then move them to a longer term unit. Now we're seeing them sit in our ERs for days. Sometimes we've called state after state, hospital after hospital, trying to get them to that longer term setting, and there's nobody that's able. So even now, I feel like I'm functioning as an ICU doctor by force, because now I'm literally transitioning people, escalating the care, the supportive oxygen that they need, redosing medications multiple times, and then sometimes watching kids go from getting worse to getting better to then being ready to go home, all in an ER room. And that's not what the emergency room was built for. The emergency room was, like I said, built for a stabilization of the acute illness and then moving to a more appropriate long-term setting. A lot of us are wondering, why is this happening? There's some theories that the kids that were born during the pandemic, perhaps their immune systems aren't as developed because they haven't been exposed to so many viruses. I don't know if I fully buy into that. I totally see where people are coming from with that theory, but the reason it's not fully panning out to me is because a lot of the kids I'm seeing were not the ones that have been sheltered at home during the pandemic. It's people who've been born since the mask mandates have been out, since they've been kind of out and about, and they're still also getting quite sick. It's unclear to me if maybe the strain of the viruses that are out right now, RSV, which is short for respiratory syncytial virus, adenovirus, rhinovirus, enterovirus. There's so many of the viruses that are out. And then of course, COVID is still out there as well. The flu also, that are really just affecting kids in such a severe way. There's some wonder, did they kind of mutate? Have they become a stronger form of it? It's not clear. I don't know what it is about this year, but this has been a forceful season to be reckoned with. And I think when I look at what does this mean for a longer term, I know for one thing is that this is not sustainable. What we're seeing right now, the volumes that we're seeing, the boarding that we're seeing, is extraordinarily unsafe. I work in both places that are pediatric only emergency rooms, so only kids are seen there, but I also work in places that see both adults and kids. And even in the adult and kids settings, we call those community emergency rooms, there is now no room for even adults to come into the emergency room and be seen whenever we're worried that they're having something very serious happening, because there's so many kids that have taken up all of the rooms because they're so sick and there's nowhere to send them. And there's a shortage on providers. There are not enough people available to provide care. So in these hospitals, a lot of them are short-staffed and they don't even have the capacity to receive these very sick kids. There's a shortage on nurses, of course. The reality is, in our healthcare system, a lot of these careers are very underappreciated and not very incentivized to stay in the fields for long terms, right? I mean, it's very arduous work. It's very emotionally taxing. You're putting yourself in the front line of risk for a lot of illnesses. You don't want to take that home to your family and watch your own kid go through that, you know? And in a lot of scenarios, there's a lot of people who are not paid to the extent to which that they're working, so they don't feel like it's worth it. They see people who are in these other fields who are, you know, doing a lot better and don't have to face the literal occupational hazards that a lot of us end up having to face in our lines of work. And so what does it look like to further incentivize and further show appreciation for the people who are putting themselves through this extremely arduous work? A lot of it is the facilities as well. There's just like not enough of these facilities in existence right now. And so once we're full, we are completely full. And this is happening across the country, where there's just the volumes are never before seen, and there's just nowhere to send anybody. I want to believe that this is temporary and we are gonna see the other side of this soon. If history is any teller, then it should last for a season. But this season has already started a bit earlier than we anticipated, is going a lot stronger than we anticipated. And so I don't know what the other side of it is gonna look like, but I'm just really hoping that we get through it without too much more harm, because there are so many people feeling it, between the clinicians, healthcare workers, ourselves, and then patients who are watching their family members, their children go through this, the parents that are losing work and ability to take care of their other kids because this is, you know, takes so many of their resources, and then the other patients who have to sit and wait in waiting rooms that are never going to empty out because there is just no way to move people on the inside of it. It's a very, very complex, devastating issue that has so many implications, but I am hoping that we see a lot of action to address some of the things that we talked about. Sorry for a grim video, but I always like to use this channel to demystify and kind of lower the barrier of what's happening and what are the things that I and my colleagues are seeing on a day-to-day basis inside of the healthcare system and what the reality is in the public. Just trying to bridge that gap a little bit. If you enjoyed this video, please, please, please leave a thumbs up. It means a lot. It means a lot to this channel, which I'm excited to start pouring back into now that life is a little bit settling out. It's been very, very hectic, obviously, as I've been in training. And subscribe, share the video with anybody that you know that might be interested in some of these topics. Leave a comment below. Have you been experiencing or hearing about these increased wait times? Have you been hearing about it on the news? What have you been hearing? What questions do you guys have? And definitely feel free to leave video suggestions below. I always like to know what kind of gaps can be bridged. As always, it's an honor that you spent this time with me, and I hope that I will see you again soon. It's Bernice. Bye. Mwah.